Last year, the Nobel Prize in Physics and the Nobel Prize in Chemistry was awarded to AI achievements. And the chemistry prize was an incredible achievement, looking at protein folding and solving the challenge of protein folding, and given to Demis Hassabis and John Jumper at Google DeepMind for their contribution to this work. Now, they're just a stone's throw away from you, Paul, at your institute. But tell us, why was that such a watershed moment?
Well, I'm sort of familiar with it because Demis and John are personal friends, actually, and they have the DeepMind labs are in the Crick, the wet labs. And it's been an interesting story, because they built it on chess and then playing games on Go, and used many of the things they learnt in those endeavours and applied it to protein folding. And I'd watched it over the last 5 or 8 years, and it was just a remarkable performance. It was a problem that was absolutely suited to the present strengths in AI. It has data available, huge amounts of data, publicly generated data, I should say, primarily by discovery research, but then open and available to the entire community. That's critical, because that is what works. It is what I call thin and widely spread data, which is perfect for this type of analysis. And this problem has been around for, since the beginning of molecular biology, since the 1970s. And the modelers have been working on it for 20 years, trying to do it bottom up. And AI, of course, provided a way of looking at it without understanding the principles behind it, but producing a way of actually predicting how the protein molecules, which is a chain of amino acids that then folds up in complicated ways, of predicting that, having known what other molecules already did. And you don't even fully understand quite how it works, in fact, but it works. And it has taken over this type of molecular biological research in an extraordinary way. All of us, including me, who's not an AI expert, I have to say, including me, that we just do it routinely. We discover a gene, it encodes a protein, we have a sequence, and we can see what it looks like, which would have taken a year or two of experimental studies to get there. So it's a great achievement. It isn't yet always completely precise, so if it really matters, you have to follow it up with actual experimental work. But it is an enormous achievement and perfect for the present status of AI.
And has it opened up your mind to the potential of AI application in other areas of sort of biomedical research and medicine generally?
Well, it made me think about it. And what they produced is a way that allows you not only to look at protein structure, but other small molecules and think of drug development and all of that. What I'm interested in, and I talk to Demis constantly about it, is can we produce improvements on the methodology, a more general AI approach, that would allow us to understand the complexity of living organisms and how they work. And that is a much more demanding problem, which I think is going to be critical for the next 100 years in medicine. But if we just take a cell, what we have going on in there is thousands of reactions, all coordinated and connected in some way to produce overall purpose. And that's then magnified again in the living organism. This is an immensely complex problem. We absolutely will need some tools equivalent to AI, but I think beyond what we now have available. And for me, a combination of that type of analysis with the right sorts of experimental analysis is really going over the next 30, 50 years, it's a long time, to help us understand what life is.
Mm. And now then maybe over to you, Alison. And you're doing a lot of work with the Fleming Institute, the inaugural director there on antimicrobial resistance and these big issues. What's exciting you around the opportunities with AI in that work?
So two really exciting opportunities that I'd like to describe. One is around the application of AI, but before I get to that, I just want to say the multidisciplinary working is also absolutely critical. So to embed fellowships, however they're funded, whether they're Google DeepMind fellows or whether they're research fellows from other programs, to actually embed them with clinicians, epidemiologists, bioengineers, chemists, clinical trialists, etc. It's just a joy to see, so that people are working from the very beginning, informing each other and understanding the potential of this, from the most basic research to the kind of policy level type of work. And then just the second area that I wanted to highlight is that I think it's important that we think about AI beyond discovery and beyond fundamental research, which is absolutely critical, and it's really exciting, because I don't think we're using it enough in health services research. I don't think we're using it enough in shaping clinical trials. I don't think we're using it enough to think about how we protect patient pathways, how we use it for healthcare resilience, and also how we address an issue of representation in data. So I think there's a huge opportunity for the application of AI within health services, research, safety, resilience, but also how we can use the data from that to inform better care, better safety, but also generate the research questions that need answering as well.
And so, so there's some barriers there that you don't think this is happening enough. That maybe there's the bigger investment in the fundamental research and less in this other space, maybe.
Well, I think there's an issue about having representative data. I also think within healthcare there's an issue about being able to follow individuals across the whole patient journey rather than different areas of that journey, and to have joined up and linked data that can support AI, but also, I mean, which is only as good as the data that goes into it, we need to remember. So I think there's many opportunities there that we're not actually using adequately, and also the issues about regulation as well. But there's such an opportunity for bringing in, for instance, diagnostics and decentralized diagnostics and the data that we can get from that can cover the whole kind of patient journey, and think about how we can use it to ensure that we have good healthcare that actually protects patients rather than amplifies infection or is a reservoir for infection as well. And I mean, I'm talking about this from the perspective of infectious diseases, but actually integrating data from diagnostics across the lifespan and patient journey is also critically important for all sorts of non-communicable diseases as well. And also it will inform, as I say, opportunities in clinical trials, targeted interventions, and policy. And
this is already happening. I think during COVID, there was some examples of AI being used.
Yes, that was really interesting. And again, this was a AI PhD working with us who did work linking diagnostic data with geospatial and patient movements, so that you could identify where the maximum nodes of transmission of COVID were. And bearing in mind that 1 in 5 patients that went through healthcare acquired COVID from within healthcare, then came in with it, that type of data is really critical. And we need to be able to use that in real time.
And Maja, maybe I'll come to you then on, so as Adam said, you're State Secretary for Health here, but you are also an expert on AI policy and governance, and a lot of your research has been on that, and you've just recently moved back to Stockholm, or to Sweden from the EU, where you were in the AI office, and you published a book on AI and power, AI and the power over decisions. We want to talk a little bit about the governance issues around AI, and particularly relevant to the sort of medical professions and some of these issues. What do you see as some of the big challenges on governance?
I think it's nice that we're starting this AI and creativity, and I also think it's interesting. In the 1990s, if you were in a panel and wanted to say you're a feminist, you always had to start by saying, but I love men. And nowadays, if you're in a panel on AI, you always have to start by saying, I love technology. And I do love technology. But I think it's interesting when we use AI as public actors. And I think that's something different, actually, than using AI as a tool for creativity. I think very many of us use AI just to, pose a question or to play with something. Sometimes that results in groundbreaking research, sometimes that just results in a less boring dinner speech. But when public actors use AI, they use the power that we delegated to them as a part of our democracy. And as citizens, I think we should, for example, demand transparency from that. And there are a number of interesting and actually quite appalling examples from European politics when public actors have been using AI or algorithms. There's one example from the Netherlands, where the Dutch government used AI to find people who were trying to commit fraud with the child allowance, and they specifically targeted people with double citizenship. So this became a racist algorithm that tracked down very vulnerable families who, in the end, showed out that 95% of them did not, do anything wrong. So there's problems, I think, or there should be a demand of transparency when we hand over power to algorithms as a part of our democratic system.
And with the governance and the EU on AI, I mean, there's AI legislation coming in, there's pushback against that legislation. But how does it, are there risks that it will slow down the innovation, or are these essential safeguards? You have in other places, the US and China, very little regulation in these areas.
Well, personally, I'm often annoyed by this narrative that innovation and regulation stands against each other. I would say that's a false dichotomy. I mean, we have a number of examples where regulation has actually stimulated innovation, and we have other examples. I'm thinking of the car, for example. We have speed limits, and does speed limits slow down the innovation of fast motors? Probably. Do we think that's a problem, big enough to take away speed limits? No, we don't. So I think that's a concerning narrative, actually. And I do think that narrative is also being pushed for political reasons. And I think that there's also a tendency, the less regulation we have on an EU level, the more responsibility is being delegated to the end user or to companies, or to the one who is actually using the AI. And that's concerning, I think. That puts us all in a vulnerable position. So I'm concerned about that.
Okay. Now, Paul, how are you using AI on a day-to-day basis? And how's all that going?
Well, I listened to my PhD student doing it, to be more precise about it. But we shouldn't forget, sometimes people use the term everyday AI. And we do use everyday AI. That's things that are not blockbusters. They're just sensible things. Like we analyze images, microscopic images, and what would take us a day or two to do, we can do in minutes. It saves us, an awful lot of time. We can do literature surveys rapidly. Instead of sending somebody to the library for 4 or 5 days, then they can get it back in half an hour. Now, what they get back is a bit dull, it's a bit conventional, it's not that creative. It sort of reads like it's been written by a robot, but of course it has been written by a robot, basically, so it's bound to read like that. But we shouldn't sneer at it for that reason. It gives you a foundation upon which it can work. I emphasize these things because actually it does actually help us. We see, of course, an immense amount of hype in the markets about it, and that's almost certainly going to collapse because there's almost no actual real applications coming from much of that investment. For discovery research, we've got a new tool that allows us to do rather dull things much more effectively. And so people are going to be able to spend more time thinking about it as long as they don't lose the capacity to think. And why I'm emphasizing that is, treat AI as providing a tool to give you the information. Do not think that is the answer. Use that information to actually come to more creative outcomes. So I'm in favor of it, but let's not think it's the solution to the problem. It is a mechanism to get towards a solution.
Okay, and then, indeed. Yes, hopefully it won't stop us thinking. This is the key thing. And Alison, on this, let's go back to AMR, and you're quite interested in, very interested in surveillance and these kinds of issues around detection and spread of disease. And you see a lot of potential with AI in that area.
Yes, indeed. But, I'm just thinking about everyday AI and also AI that can be generated from big pieces of data, which would be really good for public health and policy. But I want to think about everyday AI for people who prescribe drugs, for instance, and are wanting algorithms to support them in the optimal therapy for that individual. So personalized medicine, but also thinking about individual dosages and polypharmacy and everything. But if your data is based on you looking at, a formulary somewhere, and if that data actually doesn't include you because you happen to be pregnant and you're not a fit Dutch bloke in his 30s somewhere, but you're actually a baby, or you're pregnant, or you're a bit obese, or whatever, there is no algorithm or decision support tool that includes that data because the numbers are not there. So we really, really need to think about representation in data and how we can use some of this in a kind of global data resource to inform what we're doing, but of course with the appropriate governance and regulatory frameworks around that. But that enables us to have it as a kind of everyday tool if you are responsible for prescribing or thinking about prescribing policy. But we need that representation so that the decision support and the advice about how to prescribe and personalize and tailor therapy, we need that there.
Okay, and then so Maja, do you see this as a governance issue as well then, on that biases in the data, how we use it in a way that minimizes those biases, and how we can direct the medical research community in that way, and these sorts of issues around data protection, that is this balance between data protection and data access. How do you see the governance issue around that?
I think it's a multiple issue, really, and I think you put it very well, Alison, that sort of the data that goes in is definitely part of both the solution and the problem. And I'm thinking about when to use AI and also not to use AI, which I think is connected to that. Policy researchers sometimes speak about question zero, and that is, should we use AI to solve this problem? And sometimes the answer is yes, and sometimes it's no. But there's also a risk of not using technology, and I think you're pointing to that, Alison. And for example, in the 1950s, we were bad at detecting heart attack in women. You remember, because all research on heart failure had been done on men, and I think we risk doing that all over again when we collect data from very special populations. And if we don't use AI in public healthcare, for example, it will for sure be used in private healthcare, and then all the data collected will be from a very particular part of the population, which will make AI-based medicine bad for the majority of the population. So there's a lot of build-up in this that can be both dangerous and difficult.
Mm-hmm. Okay, and then, so as a final question, I mean, there's huge amounts of investment, huge amounts of money appearing for AI, and there's a risk that, are we spending too much on AI and then maybe ignoring some other areas of research that we should be prioritizing, or getting, or is the balance about right? Is this the most exciting area and in terms of science, and we should be putting all the money in there? But any reflections on that funding in just a few words?
Well, I said something briefly about it. There is a lot of hype out there that we just have to admit. But and so we have to be careful of that. Why I actually agree with the comments, particularly you made, that to get progress, we have to get strong connections between the AI experts and the experts who are doing the things that it's supposed to help. If we divorce these two, it just won't be productive. And that requires effort. And if we get that together, instead of just trying to see whether we can make trillions of dollars on something that is being sold in an investment way, I'm getting tired of that, to be quite honest. I'm getting tired on boards of people telling me that AI is the next revolution, and I know enough about AI to know I don't know enough, and they know nothing at all. It just is very, very irritating. But getting those who are trying to solve the problems, working closely and interactively with those who can apply the AI expertise, I think is the real way forward. Completely agree.
Yes, well put.
Then on that note, ladies and gentlemen, a big round of applause for our panel. Thank you.